My name is Giselle, and I'm going to go over types of ectopic pregnancies. So before we get into it, we need to know what an ectopic is, and it's basically a pregnancy occurring outside of the uterus, specifically the fundal part of it. Some need to know about ectopics are that those that have IUDs, have had fallopian tube surgeries, are doing infertility treatment, have had a history of an ectopic, or have pelvic infections like PID are at a higher risk of getting an ectopic pregnancy. Some clinical findings of ectopic would be number 1, pain, vaginal bleeding, and abnormal HCG levels. So in a normal IUP, HCG levels, it should be doubling every day, whereas in ectopic, they are still rising, but just abnormally. So sonographically, what we would see would be an empty uterus, a pseudogestational sac, a nexal mass, or free fluid. Some sites where an ectopic can occur would be the ovaries, which is pretty rare, and for this one we need to distinguish it from a hemorrhagic cyst or a corpus luteum. Next one is the interstitial, or also known as the cornea site. This is also rare, and this one involves the periuterine and myometrial vasculature, so this can be life-threatening if it does rupture. This sonographically, we would see a kind of thin or incomplete myometrial mantle. Next is the most common, which is the fallopian tube. Next is the cervix. If it was a true cervical pregnancy, we would see that concentric gestational sac with the echogenic decidua and increased color Doppler. If it was an SPL, the gestational sac would be misshapen and there would be a lack of color Doppler. With this site, there is a risk of receiving a hysterectomy because of the uncontrolled bleeding caused by the increased vascularity of the site, or patients can also take methotrexate for treatment. Now we're going to go over some sonographic images, with the first one to the left being the normal IUP. So we see that gestational sac with that decidua not only going around the gestational sac but also around the uterine cavity. And that just tells you that it's eccentrically placed, which is what we want. And then we can also see that embryonic disc as well. Next, we see some fluid in the uterine cavity. We don't see an embryonic disc, we don't see a yolk sac. It is weirdly shaped. If the patient does have high levels of HCG, we might be seeing an early IUP, or this can also be associated with an ectopic. Now let's say these two images correlate with one another. If a patient comes in with high levels of HCG and we're sweeping the uterus and we don't see a gestational sac, but we go ahead and sweep the adnexas, and that left adnexa we see a structure right in between the ovary and the uterus, this is a given sign that it is an ectopic pregnancy, and it is going to unfortunately be non-viable. Now let's look at the image to the left. We see some echogenic free fluid in the cul-de-sac, and this is a given sign that it is an ectopic or a ruptured ectopic. So this is what a normal corpus luteum cyst looks like, and we should not mistake this for a ectopic pregnancy. So with this corpus luteum, we see thick echogenic walls. If we put color Doppler, we're going to see that ring of fire sign, usually measuring less than 5 centimeters. However, if we do see echogenic debris or septations and it's a little bit larger, then this leads us to believe that it did hemorrhage. With this, they do tend to regress 16 to 18 weeks of gestation. So if we were to see it persist beyond then we're more suspicious about what it is. All right, some important things to remember is that we need to correlate HCG levels with ultrasonic findings. We need to know the difference between a corpus luteum cyst, hemorrhagic cyst, and an ectopic pregnancy. Spectral Doppler really comes into play, especially if we want to know if a gestational sac is true or not. With the true, we're going to see that low resistance waveform, and with the pseudosac, we're going to see that high resistance waveform. And like my teacher said, if we know what normal looks like, then it's going to help us really understand and find those things that make it look abnormal. And I do want to finish this off by saying that pregnancy is a very complex thing that women have to go through. So if you have unfortunately experienced pregnancy loss, please give yourself time to grieve and just know that there is light at the end of the tunnel.